There's a lot of victories in pain management. You get to see a lot of people do better, and so it's the best part of my job when somebody comes back to the office for their follow-up visit and says, "Hey, I'm feeling great." As an Indian child, my parents always told me I was going to be a doctor. When you're really sick, it all turns around when you go see the doctor. And so I thought to myself, that's what I want to do. I want to help people. So my specialty is chronic pain. And so patients that I see have had quite significant pain for quite a while. We're now in the midst of an opioid epidemic. And so we've really switched gears from prescribing a lot of opioids to trying and finding other ways to manage patients' pain. I had a patient come to me whose provider had recently retired, and so they had been on high levels of opioid medication for their back pain. We then progressed to trying new injections, and we were able to completely get him off opioids, continue to function at work. And the most memorable part of that whole thing is at the end of his visit, when we were done with his treatment, he came and he gave me a hug, and it was somebody that I thought I would never satisfy. I'm a big believer in listening and spending a little extra time with people because I think it truly helps. Not only helps us understand what's going on and try to figure out what's going on, but I think it helps treat the whole person. I'm from Valparaiso, Indiana, so I trained very close by in Chicago. A fun fact about myself is that I truly love ice cream, and thankfully my parents have a Dairy Queen, so I got to work at Dairy Queen for 40 to 60 hours a week growing up for free. I'd like people to remember me for trying not to rush them out, for really caring about whether or not they did better.